Each year since 2011, BizTimes Media has recognized an extraordinary southeastern Wisconsin female business leader for her career achievements and also for her contributions to our community. You can see previous recipients of the Woman Executive of the Year Award on the screens. They have included leaders from Harley-Davidson, BMO, the United Way, the YWCA, Milwaukee Urban League, Mount Mary University, Freighter, and others. This year, we add Peggy Troy, President and CEO of Children's Wisconsin, to this prestigious group. Children's Wisconsin is a large and renowned healthcare provider with 6,500 employees and numerous locations throughout the state. Peggy started her career as a pediatric nurse at Children's in 1975 and, after several roles in other parts of the country, returned to the organization in 2009 to lead it. She will retire by the end of this year at the conclusion of the transition to a new leader at Children's. Peggy unfortunately had a previous commitment and is unable to join us today. However, I had the opportunity to speak with her recently to discuss her career journey and what has made her and Children's Wisconsin so successful. Well, congratulations to Peggy Troy, President and CEO of Children's Wisconsin, on being recognized as the 14th BizTimes Media Woman Executive of the Year. She will be concluding an accomplished healthcare career, retiring soon at the end of the transition to the new CEO here at Children's Wisconsin. So congratulations, Peggy, and I want to just start off talking about what got you started, what led you into the healthcare field to begin with?
Well, so it was in my childhood. My father was a primary care physician in a small town in northern Illinois, preceded by my grandfather, who was the first doctor to ever move to that town. And back in that day, there were about 5 or 6 generations that had been with either my grandfather or my father. So there was a lot of continuity of legacy between the two of them. And so when I was a young girl, I have fond memories of people stopping by the house on a Saturday or Sunday and maybe getting a fish hook out of their finger or some other little minor thing. He'd often go into the office after church on Sunday because people would come up to him after church and say, "Oh, well, I'm just not feeling so good." And so he'd go in and have office hours. I also was in the process of growing up, made house calls with him where I'd stay in the car, but he'd go in. And of course, you knew so much about the families because of that multi-generational, and you knew so much more about the families than your typical medical visit. And I learned early on the importance of all the other things that impact people's outcome, including housing and food and the social determinants of health, as we call that today. So I really had a very well-rounded exposure to it as a young child. And my father was the ultimate servant leader. I mean, he was literally there to serve others. Not only his 6 kids and my fabulous mother, but all the other people that counted on him for good medical care. So I just grew up that way. My 3 older sisters are nurses, and that was my pathway forward.
And what town was that?
McHenry, Illinois.
Ah, okay. So that sort of led you into healthcare. What developed your passion for providing healthcare specifically to children?
Well, so I entered the nursing program at Marquette University, and a very, very good, solid nursing program. I was literally scared to death to do my pediatric rotation. I thought, oh my gosh, these kids are going to call you out. You know, they're going to cry. You know, we've got moms and dads. And I had a mentor, my instructor, Dr. Jean Hennessy, who was just phenomenal. The way that she thought about the kids, took care of the kids, to work with the whole family. By the end of that rotation, I knew that's the place I wanted to be, and I've never looked back. That's my passion.
It's incredible the impact mentors like that can have on our careers and our lives. And then you started at Children's in 1975 as a pediatric nurse, is that correct?
I did.
And what was that, what do you remember from those days?
Well, I remember that we were in a very old building on 17th of Wisconsin, which is now Humphrey Hall for Marquette University. And I ended up being the nurse on the night shift on a unit with about 30 patients. And boy, I learned so much because you were it. You had to make it happen. And whether it was mixing formulas in the scary basement where they said was possessed by ghosts, or filling IV bags with medications, you did it all. And so I learned a lot about just running things, because early in my career, that's what I did. I ran it. And I had fabulous mentors along the way that really have helped me develop in my career, encouraging me to go along, to grow and develop. Also point out where I needed some help and needed to think about things differently. So having fabulous mentorship, I think, is such an important asset when you are learning how to be in your career and advancing. And so for those of you who are mentors out there, thank you, because that's what helps us as younger individuals do great things.
Did you ever think back in those early days, you talk about running things, but did you ever think you would be running a massive organization like what Children's Wisconsin has become today? 6,500 employees, numerous locations throughout the state. What would you have thought then if you knew where you would end up?
I often say if I knew that, I probably would have messed it up along the way. I never imagined that I would have the privilege and honor to serve in this amazing organization that's 100% dedicated to kids and their families. And it's, like I said, I can't emphasize enough, it's a privilege and honor. And I will tell you that I work with the most amazing people you could ever hope to have on your side, on your team. I walk through the halls, and whether it's somebody that is in environmental service or a nurse or a pharmacist or clinical engineering, people know why they're here. They're here to make kids' lives better. And they do that with passion and energy and commitment to make sure that we're doing everything we can to create that great experience for the kids and their families.
How did you advance through your career? You talked about starting off as a pediatric nurse. What were the steps? How did you advance through your career to end up leading Children's Wisconsin?
Well, so early in my career, I really paid attention to quality. Because, again, if you want to give the best and safest care to kids, you really have to pay attention to the quality of the care. And I was a neonatal intensive care nurse down in Chicago at the time, at the Children's Hospital, and I noticed that there were some issues around quality that needed to be corrected. And I spoke up. I took the risk. I said, I think there's some things you need to know, to my supervisors. And the next thing I knew, they were asking me to take on a bigger role in the organization. There was a fork in the road where when I went into my master's program, I was going to either do education, but again, a mentor encouraged me to think about an administrative role, and I chose that pathway and have progressively been able to achieve new and different things. Because I was there, I got involved. I volunteered to be on committees. I volunteered to do new and different things. So I think that's what really helped me, is because I was there when I was present and I cared.
When did you realize you had the ability and the opportunity to lead an organization like this?
I would say that when I was in Fort Worth and I was started out as a director, then went to a vice president, and then to a chief operating officer, and then the president of the hospital. Yes, I had a CEO that I reported to, had a lot of board exposure, a lot of exposure to the physicians, and I really enjoyed every next step. I really enjoyed it, and I had the mentoring and coaching it took to help me be successful in those roles. I also knew surrounding yourself with great people really makes all the difference in how you're able to perform in your job, because no one person's an island, especially in a complex business like healthcare. And then I went on to accept a position to run the Children's Hospital in Memphis, Tennessee, which was part of a larger adult system. And I was then asked to step into the chief operating officer role, where I was over 7 hospitals. So I knew then if I could run 6 adult hospitals and a children's hospital, and have the board exposure, the community exposure, the financial acumen, that I would be able to successfully become a CEO. So it was a progressive, every iteration, I had more experience, more exposure, learned a lot, and I can't underestimate the value of mentors.
And then you returned to Children's Wisconsin to lead this organization.
I did.
And what year was that, do you recall?
Yes, it's 2009.
Okay.
So I was asked to, there was a national search, and I was asked to be a candidate. And actually my predecessor, I didn't know this so recently, recommended me to the Board of Trustees as a person that he would imagine could succeed him. I knew him from Children's Hospital meetings across the country. And so I actually applied for the job, went through the interview process, and here I am 15 and a half years later.
Reflecting on that 15 years, what are you most proud of during that time leading this organization, particularly with the culture that you've established here?
Well, the thing I'm most proud of overall is the culture. We have a phenomenal culture, and like I said, we have very strong values that we all know and understand, and we've got an amazing Board of Trustees, an amazing community, both giving gifts of time and treasure. But I'm really proud of the fact that we think about kids as the whole child. So back when I started, we needed to go through a strategic planning process, and we looked across the country and where Wisconsin was relative to kid outcomes. And we saw then that we were about at the 50th percentile of outcomes for kids in the country. This is the Midwest, we could do better. But when you looked at the central city of Milwaukee, we fell to the bottom. And I'd just been in Tennessee on the Mississippi border, so I'd seen some real complexities kids faced. So we adopted when we thought about all the pieces and parts that comprise children's, with a health plan and a physician practice, academic relationship, multiple locations, we said, boy, if we do all this, the kids of Wisconsin could be healthier. So we adopted the vision. We want the kids of Wisconsin to be the healthiest in the nation. And we're going to do that through clinical care, advocacy, research, and education. And we built a strategic plan from there. We just refreshed it at the end of 2023. And one of the centerpieces of that strategic plan is we talk about the whole child. Because when we define health for kids, for anybody, we talk about physical health, we talk about social health, we talk about dental health, and we talk about mental health. So lately, what I've really been extremely proud of is our commitment to mental health, because we know that this has been a very underappreciated part of kids' health, and it needs to get addressed. It needs to get addressed holistically. And so when we looked around and saw, okay, what are others doing? What are the assets and resources in the community? We said, let's not wait until kids have to be hospitalized or incarcerated. Let's back it up. And so one of the things I'm really proud of is that we've developed a program here that we're going to start early in kids' lives to evaluate their mental health, parenting skills, all those things that it takes for a child to grow up and be healthy. And so we've invested heavily by placing mental health workers in the pediatric office. We have 22 locations of pediatricians around southeast Wisconsin, and we said, let's make that part of the developmental screen with kids. And so if there's a problem, because at the time, if a parent had a concern about a child, they may be handed 5 phone numbers and get an appointment in 6 months to a year. Now, they're right there, the mental health workers alongside of the pediatrician, and can start working with the families right then and there. So if you can start to assess parent attachment issues in the newborn period, you can detect early signs of depression and anxiety in kids as little as 2. Let's imagine that if we back that up and really start working then, we could change the trajectory of what often happens in these kids' lives. We have a walk-in clinic for mental health, so much like if your kid's got an ear infection or a cold, you can walk in and get treatment right away. And then we have all levels, developmental pediatrics, psychology, psychiatry, so we've filled the gamut. And we just recently hired a researcher to study to see if this is working. But the thing I'm so proud of is the willingness of the community to invest. We made the commitment that we were going to spend $150 million on mental health, and we've raised 60. So we're in about year 3 right now, and I'm very hopeful that through research we're going to find that we are making a difference. And so we'll lessen some of the outcomes for these kids up to and including suicide, because we have a very high teen suicide rate in the state of Wisconsin.
As you hand the baton to a new leader, do you have any other thoughts about the future of Children's Wisconsin and where you think it's going?
I do. So there's a few things that are sort of my philosophies about all this. Number one, we need to stay independent. We need to stay self-governed, because that allows our Board of Trustees, along with the senior leaders and the CEO, to invest dollars back into kids. So everything we do is about the kids in terms of the types of people we hire, the programs and services, et cetera, et cetera. So that's number one, stay independent. Well, how do you stay independent? One is you got great culture, great workforce, but you have to stay financially solid. And in today's world in healthcare, that's difficult. Our doors are open to everyone. And so about 50% of our revenue stream comes from Medicaid, because sometimes families find themselves in distress situations, and it's a safety net program. Well, if they only pay you a certain percentage of your cost, having a healthy balance sheet is really important. And so fortunately we have a great foundation board with a great investment committee, and so we now have assets of $2 billion. So we can weather a COVID or other things that come our way. So, and then, just be part of a community. Yes, we're out here in Wauwatosa, but we have 40 some locations across the state. We want care to be closer to home, so that when kids out in the Upper Peninsula have a health issue, they don't have to come to Milwaukee for everything that they need. And we've done that around the state. So my advice is stay strong, stay independent, value your academic relationship, because that's your future workforce, whether it's doctors, nurse practitioners, nurses, respiratory therapists, pharmacists, you name it. Value your workforce and replenish it so that you can have the capability to do what you need to do to take care of kids. And then just our government relations are really important, because we've got to be the voice for kids. 70 million voters across the U.S. and no one under the age of 18. So it's very important, particularly in children's health care, that you have strong relationship with your elected officials and their staff, because they determine policies and positions, and we need to really make sure that kids are being thought of as those are being developed. So it's another very important part of the role of a children's hospital.
Right. What's next for you?
Well, as was mentioned, I'm committed to be available to children's until the end of the year, because I wanted to help plan a very successful transition for our new leader. And I have 2 adorable little grandkids that are out in Utah, so I'll spend some time with them, and I'll take it as it comes. I don't have a big plan, and but I'll take it as it comes.
Well, congratulations again on this well-deserved recognition and on a terrific career in healthcare, and particularly in serving the needs of children.
Well, thank you, and it's been, as I mentioned before, a privilege and honor, and I couldn't think of a better way to end my career. To be the CEO of this amazing children's hospital is better than I could have ever hoped for. I want to thank you for this very prestigious award. I'm so grateful for the recognition, and it really goes to the people that work at Children's, because they do amazing work every single day. And I want to thank all of you in the audience today. You're the women. You're the ones that are helping lead this amazing city. So keep investing your time, your energy to continue to make Milwaukee a great place for people to live and work, and be mentors. Be mentors. It matters. It matters to our younger workforce, and you can do a lot to help them grow and be the future of our great city.